Dr. Ramesh sir and Dr. Avinash sir, we have more than 280 participants. Whenever you feel like sufficient threshold, please, you can start. Thank you.
Yeah, sure, Avdesh. So we can wait for another couple of minutes before we can start. I think
Sure, sir.
Dr. Avinash is also there with us. Dr. Ajay is also there.
Okay, sir. Noted, sir.
Yeah.
Good morning, everyone. Greetings from the NPNCD National Training Cell National Program for Non-Communicable Diseases. We welcome you to this yet another webinar of the annual webinar series, which we have every fortnight. Today, we also happen to observe the World Health Day, 7th April, and the observance highlights the pressing health issues and collectively how we can mobilize our actions. It motivates us how we can mobilize our actions to improve public health outcomes. And it was started by the World Health Organization in 1950. Today, the this year's theme, 2025, the theme is healthy beginnings and hopeful futures, wherein the government of India through the Ministry of Health and Family Welfare endeavors to strengthen its commitment to equitable, accessible and quality healthcare. And over the past decade, we have made a lot of notable strides. Initiatives such as the Ayushman Bharat Yojana and the National Health Mission, which has considerably improved the health outcomes. Today, we have more than 1.76 lakh Ayushman Arogya Mandir in form of health and wellness centers, which take the which cater to the healthcare needs of the takes the healthcare to the doorstep of the people, uh, providing comprehensive primary care. We have achieved more than 1.7 crore hypertension cases have been screened. More than 94 crore diabetes screenings have been conducted. More than 5 crores of wellness sessions for yoga meditation they have been held at Ayushman Arogya Mandirs as of um, February 2025. So we continue to, with team effort and collective support, we continue to uh, make come together to achieve this, work towards resilient future to for Indian healthcare landscape. Today we have um, um we have an eminent expert to speak on the topic. Before this, I would like to request Professor Ramesh Agarwal, sir, ADG, Non-Communicable Diseases, Ministry of Health and Family Welfare, to kindly take over and deliver the keynote address and introduce us to the speaker. Over to you, sir.
Thank you, Dr. Avinash. I again welcome you all on behalf of the Ministry of Health and Family Welfare, DGHS, and NPNCD division, and must congratulate myself and the team and all of you who are here today that successfully we have been conducting this webinar series now for over a few months, and with eco team and of Deji who are here, who support us technically and bring out this version, and you all people who support us in having this webinar series in educating all of us for the non-communicable diseases. So, just have a brief word about the non-communicable diseases which we are suffering throughout the country, particularly obesity. diabetes, hypertension, cancers, strokes, kidney diseases. So the goal here is to prevent these diseases. And as Dr. Avinash has said, that with all the support from the peripheral health centers, the Ayushman, and whatever at the peripheral grassroots level, so we have started screening our population and trying to address this growing burden of non-communicable diseases. Health beginnings and hopeful futures. स्वस्थ शुरुआत आशाजनक भविष्य. तो शुरुआत तो we have done with all your support with this series of webinars, screening population, trying to identify the diseases, and referring those patients who are screened early to the higher tertiary care centers, getting the treatment. So this is one of the steps where we are leading, and probably in the coming years, we will be able to achieve the WHO's goal, health for all. Prime Minister, sir, also had said, Arogyam Param Bhagyam Swasthyam Sarvarth Sadhanam. So we all know that if we are healthy, if we are nirogi, so probably we can achieve anything. That is our destiny, that becomes our destiny. निरोगी होना ही परम भाग्य है और स्वास्थ्य से अन्य सभी कार्य सिद्ध होते हैं. And we all are aware about this. We all are working for this. So to further highlight how and to celebrate this World Health Day, which is being celebrated on this 7th of April, we have eminent speaker with us, Dr. Ajay Kumar Gupta, who is a leading practitioner, who is an academician, who has worked for the community, and he shall be driving us today, telling us about how we can prevent non-communicable diseases, how we can achieve the health for all. So Dr. Ajay Kumar Gupta, please, the mic is yours, the platform is yours. Please go ahead. Thank you.
Thank you, Dr. Ramesh and Dr. Avinash. And at the outset, I thank the Ministry of Health and Family Welfare, DGHS, and the NPNCD division for this opportunity. So, जैसे डॉक्टर रमेश ने कहा ना कि निरोगी होना ही सबसे बड़ा मूलभूत हमारा उपचार का पहला जो वर्ड है वो हमारा निरोगी होना ही है. अब निरोगी होने के लिए हम क्या क्या कर सकते हैं? एक मिनट, I'll just share my slides first. So, are my slides visible?
Yes, sir. Please go ahead.
So today we'll be talking about the non-communicable diseases prevention and the control for the UHC. So when we say UHC, UHC is the universal health care. So जैसे भी डॉक्टर रमेश ने बताया कि हमारी नॉन कम्युनिकेबल डिजीजेज में मेजर जो डिजीजेज आती हैं वो है ओबेसिटी, जो कि लीड करती हैं कार्डियोवैस्कुलर डिजीज जैसे कि ब्लड प्रेशर, हार्ट अटैक, फिर डायबिटीज. देन वी हैव द रेस्पिरेटरी डिजीजेज विच आर नोन एज द क्रॉनिक रेस्पिरेटरी डिजीजेज which are usually non-infective and chronic, and then we have the cancers. So आज हम वर्ल्ड हेल्थ डे पे इस चीज के बारे में क्यों बात कर रहे हैं? बिकॉज देर इज अ वेरी वेरी rising pattern of these non-communicable diseases in the India. If we just talk about the World Health Day, so this World Health Day we observe it on the 7th April, which marks the founding of the World Health Organization way back in 1948. The aim for these types of webinars or these types of days is to raise the awareness on the global health issues. और आजकल जो सबसे बड़ा हेल्थ इशू है वो है नॉन कम्युनिकेबल डिजीजेस एंड हाउ टू हैव अ इक्विटेबल एंड द एक्सेसिबल केयर टू प्रिवेंट दीज डिजीजेस. Now, if we just talk about the relevance of World Health Day to the NCDs and the UHC, the NCDs alone, they are a cause of 70% of the global health deaths, out of which 77% is in the low middle income countries because of many many reasons. Because of low awareness, the literacy levels are low, we are not able to defend ourselves from some of the diet patterns, the accessibility to the healthcare, then the exercises. They are the major issues which come across when we are talking about the lower middle income countries or lower middle income groups. Then, like I said, that India means in the major NCDs like the cardiovascular diseases, diabetes, cancer, and the chronic respiratory diseases, India has got a multiple problem. So one is the NCD and other is the infectious diseases. Now infectious diseases के ऊपर तो हमारे बहुत सारे programs भी हैं, हमारा focus भी है. Now the goal is to integrate the NCD and prevention, means the NCD prevention into the UHC, so that we all know about how to prevent these NCDs. We can make our patients aware of the usual prevention protocols, or maybe the exercise protocols, make them fit so that the overall burden of these NCDs are decreased. So, like I said, that our objective is to first understand the burden and the risk factors. Then we'll be learning something about the major NP-NCD program, which is the National Program for Prevention and Control of the Non-Communicable Diseases. Then how can we have the role of the medical officers? So implementation roles for the medical officers. Then how can we use the technology which we are having, and the hospital management and integrating system for the tracking. And then we can achieve this urban health coverage through the NCD control. So we'll be talking about these things. So in a gist, भाई हर डिजीज का कोई ना कोई रिस्क फैक्टर होता है. तो if we just calculate or we see कि what all risks we are having. So the cardiovascular disorders are majorly caused because of one, the blood pressure or the hypertension, then tobacco intake, then poor diet compliance and the poor diets. And the major thing which is now happening because of the urbanization is the sedentary lifestyle. More and more things are becoming automated and machine related. Then in the recent days we must have seen in our places that the even the rickshaws, they have been made the battery rickshaws, and the lifestyle of the even the lower income group has been changed into the sedentary lifestyle now. So when we talk about the diabetes is caused majorly by the obesity. Then genes, they do play a role, and then the diet and also the inactivity also plays a role. And in the cases of cancer, the tobacco, alcohol, infection, and pollution, they are market risk factors for causing the cancers. And if we talk about the chronic respiratory diseases, the tobacco, the biomass smoke, though it has been reduced much less now, but yes, it is still there in some parts. Then the pollution. So in all, we say that all these behavioral factors and plus the metabolic factors, they combine and form the disease. So this is just a flow chart, or this is just a chart to explain that these are the trends and patterns of non-communicable diseases, and these are the major things like the pollution, the tobacco use, the unhealthy diet and nutrition, the physical inactivity, the harmful use of alcohol, the stress and the mental health. They are all partnered, or they are all the parts which causes the non-communicable disease, and thus they are the major risk factors for causing the NCDs. Now, how to prevent it means what should be the strategies which we can have or which we should follow. So first is the lifestyle interventions, like the promotion of the physical activity, the healthy diet, the tobacco cessation. Then we talk about the screening and the early detection for high risk groups, and also the public health awareness campaigns. Like you can have a public health awareness campaign in the nearby area where you are practicing, or where you are having your offices. Sorry. And then we can take the help of the government in making the legislative measures, like putting a taxation on the tobacco and alcohol, and also having a proper label on the food which we are providing. So these food labels can say that these food can cause obesity, this food can cause cancer, this is a smoked food, this is a high calorie diet, this is a low fiber diet. So such food labeling should be promoted, and these can be done by the legislative measures. Like first of all, if we talk about the diet and exercise in the NCD prevention, so when we talk about a healthy diet, the healthy diet constitutes of good number of fibers, good number of nutrients, a, a diet which is having all parts needed for the body, like the carbs. It should be having good amount of proteins, then fat should be in a calculated manner, then the minerals and vitamins should be there. So when we talk about a healthy diet, it helps in reducing the obesity. Then we have the good control of the diabetes, and also we are having a lower CVD risk. Then the physical activity. These physical activities means whether you do the aerobic activity or the anaerobic activity, so they lower the BP. When we talk about the aerobic activity, it is just to burn out the calories. And when we talk about the anaerobic, they are the muscle building or the muscle training activities. So they help in lowering the blood pressure, and also they overall improve the cardiovascular health. And the nutrition, like I said, good amount of fruits, vegetables, and whole grains, they make a balanced nutrition. So just before this slide, I would just like to say a few things if things allow. जैसे हमारे हमारे पुराने शास्त्रों में लिखा है कि हम पंचभूत के बने हुए हैं, तो हर चीज पंचभूत से रिलेटेड है. तो जो मैंने अभी तक आपको स्लाइड में बताया उसमें पंचभूत में आचार, आपके विचार, आहार और विहार, ये चार बहुत इंपॉर्टेंट है. और पंचभूत जो होता है वो उपचार है. तो उपचार का ऑप्शन या उपचार हमारे सबसे नीचे आना चाहिए. तो इन पंचभूतों में जैसे हमने बताया, आचरण आपका सही होना चाहिए. आप आपका जो आचरण है उसमें आप अल्कोहल और टबैको ये कम रखवाएं अपने मरीजों से या अपने श्रोताओं से. फिर विचार, हैव अ स्ट्रेस फ्री बैलेंस्ड माइंड. जब भी आप सोएं, ठीक से सोएं, तसल्ली से सोएं, थोड़ा मेडिटेशन करें. फिर आता है आहार. आहार बहुत इंपॉर्टेंट है. जैसे मैंने आपको बताया ना, बैलेंस डाइट, जिसमें आपके नट्स भी हों, ग्रीन वेजिटेबल्स भी हों, आपके कलर्ड फ्रूट्स भी हों, फिर होल ग्रेन्स भी हों, स्प्राउट्स हों, ये सारा चीज आपका आहार बनाता है. फिर है विहार, यानी वॉक, एक्सरसाइज, एरोबिक या एनारोबिक ट्रेनिंग, ये. और फिर पांचवा आता है हमारा उपचार. तो if we talk about now the NCD and universal health coverage, अब how to link all these things. अब ये जो उपचार की बात आएगी तो इसमें हम कैसे इसको लिंक कर सकते हैं. तो UHC is a access to the quality health service without the financial hardship. यानी everybody gets a good quality health service, but with a lesser amount of financial incurrence. So अब क्या होता है कि when there is a number of patients, तो हमारे जो कॉस्ट है वो बढ़ जाती है, हमारा जो केयर है वो हैम्पर हो जाता है, रिसोर्सेज हैं वो कम पड़ जाते हैं. So NCDs are a potential threat to this universal health coverage because they need a very long term care and the management is quite costly. If we talk about management of a simple fever or diarrhea, it is very less costlier than having a cardiovascular disease patient, because he may be requiring costly investigations, then he may be requiring some costly medications. So our focus should be on prevention and early detection, so as to, like Dr. Avinash said, that we should be having an equitable and the cost-effective treatment, and our government is focusing on this, and we are already on the actions. So we are to prevent and detect early, so as to give a proper result, and so as to utilize our resources intelligently. So for that, we need an integration of the NCD care at the primary health care level. यानी जब हम प्रिवेंशन की बात करते हैं तो प्राइमोडियल, प्राइमरी, सेकेंडरी, टर्शरी, तो टर्शरी पे पहुंचने ही ना दें हम आदमी को. हम रूट लेवल से ही काम करें ताकि हम आदमी में ये इच्छा जागृत करें कि भाई आपको एक्सरसाइज करनी है, आपको खान पान का ध्यान रखना है, आपको अपनी बीमारी का जो रेगुलेशन है वो ठीक रखना है, आपको अपने टेस्ट रेगुलरली कराने हैं. और ये सब बात डॉक्टर के पास ना आके हम प्राइमरी हेल्थ केयर लेवल पे बात करें. और इसीलिए ये प्रोग्राम लॉन्च हुआ था, विच इज दी NPNCD program. So this was launched in 2010 with the target of screening, early diagnosis and management. So we screen the person early, we have early diagnosis. Yes, you are having a early diabetes, Now, the first part is this, second part is this. So the complications are less and the patient is treated very early. उसको अस्पताल आने की जरूरत ना पड़े, वो प्राइमरी हेल्थ केयर में ही सब कुछ उसके लिए चीजें अवेलेबल हो, और इसीलिए ये 3 टायर इम्प्लीमेंटेशन किया गया है फ्रॉम द सब सेंटर पीएचसी, द सीएचसी एंड द डिस्ट्रिक्ट हॉस्पिटल्स. एंड जैसे डॉक्टर साहब ने बताया कि वी नाउ आर हैविंग सो मेनी आयुष्मान भारत आरोग्य मंदिर. सो आयुष्मान भारत हेल्थ एंड वेलनेस केयर सेंटर्स ये भी बनाए गए हैं अंडर दिस प्रोग्राम. सो वी टॉक अबाउट दी सर्विसेज, जो हम सर्विस करते हैं उसमें क्या है कि पॉपुलेशन बेस्ड स्क्रीनिंग है इन ऑल पीपल हु आर 30+ एज ग्रुप्स. So we have an opportunistic screening at the PHC, CHC, and the district healthcare levels, and we are having the NCD clinics at the CHC and the district hospital levels. और हमारा जो मेजर काम है वो है हेल्थ प्रमोशन एंड बिहेवियर चेंज कम्युनिकेशन. सो इंस्टेड ऑफ जस्ट गिविंग अ प्रिस्क्रिप्शन एंड राइटिंग मेडिकेशंस, आवर प्रोग्राम इज बेस्ड मोर ऑन द हेल्थ प्रमोशन. आप कैसे अपने आप को स्वस्थ रख सकते हैं, आपकी आवक हम कम करना चाहते हैं ताकि आप स्वस्थ रहें, ये हमारा फोकस और से और होना चाहिए. And referral at the right time for the management at the higher centers, so that the complication rate is decreased and the overall health burden is decreased. And some short about the Ayushman Bharat and the NCD control. So we have the, like I said, the Ayushman Bharat and the NCD wellness centers. So they deliver the NCD, they are for the NCD screening and care. देन हमारे पास पीएमजे योजना है, प्रधानमंत्री जन आरोग्य योजना, जो कि सारा ट्रीटमेंट कॉस्ट को कवर करती है. अब इसका फायदा हमें क्या है, मींस हाउ आर वी बेनिफिटेड. सो द बेनिफिट इज कि देयर इज अ इंप्रूव्ड एक्सेस टू द क्रॉनिक डिजीज मैनेजमेंट. भाई जो बीमारी हम पहले बोलते थे अरे शुगर होगी तो अभी तो शहर ही जाना पड़ेगा, नो, क्यों जाना पड़ेगा शहर को, सब कुछ हमारे पास है यहीं पे. At the PHC level, we have got everything. So we have improved access to all these chronic disease managements. Then we have the telemedicine services. So we are expanding these telemedicine services to the NCD cares. So we don't need a physical checkups to be done. It has been screened, it has been seen by the PHC, and then we can have the telemedicine services. Then we have some good programs. जैसे मैंने आपको बताया कि आपका विचार और आपका विहार. अब विहार का मतलब एक्सरसाइज से. तो विहार में हम अगर बात करें तो हमारे पास एक फिट इंडिया मूवमेंट है, और आहार और विचार के लिए ईट राइट इंडिया मूवमेंट है. तो फिट इंडिया मूवमेंट जो है वो आपकी रेगुलर फिजिकल एक्टिविटी को प्रमोट करने के लिए बनाया गया है. अब फिट इंडिया को एसएआई भी प्रमोट करती है, और ईट इंडिया को एफएसएसएआई भी प्रमोट करती है. तो एफएसएसएआई का इनिशिएटिव है टू एनकरेज दी हेल्दी डाइट प्रैक्टिसेस. हेल्दी डाइट प्रैक्टिसेस का मतलब है कि आपको जो है उसमें हर हर खाने के साथ आपको उसका कैलोरी कंटेंट, उसमें कार्ब कंटेंट और उसमें प्रोटीन कंटेंट, फाइबर कंटेंट सब मिलेगा, ताकि आपको पता चले कि भाई आप क्या खा रहे हैं. हाँ, अब क्या कैसे खाना है ये फिर आपकी समझ के ऊपर और आपकी रिक्वायरमेंट के ऊपर डिपेंड करता है. फिर स्कूल हेल्थ प्रोग्राम्स विच इज रनिंग वेरी वेरी सक्सेसफुल. तो जैसे हम कहते हैं ना सब, हमारी नींव मजबूत होनी चाहिए. हमारी नींव मजबूत होगी जब हमारी यंग एंड एडोलेसेंट एज ग्रुप के जो लोग हैं वो हेल्दी रहेंगे. तो वी आर प्रमोटिंग द हेल्दी हैबिट्स राइट फ्रॉम द यंग एज, फ्रॉम द स्कूल इटसेल्फ. तो वी डिक्रीज द ओबेसिटी, वी डिक्रीज द burden of these weight gains and the diabetes or the insulin resistance जिसको हम बोलते हैं, right from the young age and the adolescents, so that when they reach the adulthood they don't develop the diabetes early. And then we have the image movements, like we have the campaign logos or the promotional visuals. So these also help in catching the things. भाई जैसे हम किसी की फोटो देख के एकदम से उसके साथ अटैच हो जाता है कि हाँ यार ये फोटो अच्छी है या ये लोगो अच्छा है. तो इस तरह के लोगोस बनाने में और प्रमोशनल वीडियोस बनाने में हम और मदद कर पाए. अब सबसे इंपॉर्टेंट रोल आता है हमारे मेडिकल ऑफिसर्स का, जो एनसीडी स्क्रीनिंग है वो करने में काम आएंगे. सो दे सुपरवाइज दी एनसीडी स्क्रीनिंग. हमारी आशा वर्कर्स, एएनएम्स और सीएचओस ये जो भी काम करें उसको सुपरवाइज करें. एंड देन देयर रोल इज टू कंफर्म द डायग्नोसिस ऑफ ऑल दीज डिजीजेस like hypertension, diabetes, suspected cancers. So if we are able to confirm right from the beginning, we'll be able to start the treatment and give a better results. Then initiate and monitor the treatment. And like I said, that we have to refer the complicated cases so that the burden of the district hospitals and the tertiary care hospitals is decreased. We refer only the complicated cases, and all the general cases, they are being taken care of at the PHC and the CHC level. Then counseling, which is very important. This can be helped and screened, or the supervision can be done by the medical officers. And important is to maintain the NCD register. So NCD register का फायदा क्या होगा कि we have a registry of all the people who are suffering from a particular disease, and then we can follow up them. Because कई बार क्या होता है कि patient आपके पास follow up के लिए नहीं आएगा, तो we can go and follow up with them. So that is the importance of these registries, and these registries, they help in making the policies. So the policy makers, they get a help that what is the burden, what is the challenges, what resources we need. So these registries or these registers, they help in policy making for the government. So if we talk about the population-based screening flow chart, so like I said, the first is the ASHA worker or the community-based assessment checklist. Then we screen at the Anganwadi or the health wellness centers for the blood pressure, the sugars, and then we have the oral, breast, and cervical cancer evaluation. Then at the MO level, we can have the treatment or the referrals, and followed by the CHO or the ANM. So this is the population-based screening flowchart, which we suggest that should be followed in all areas so as to curtail down or to bring down the NCD brunt. And also, like I say, that we should be using our technologies. We have this CPHC NCD app. It is the comprehensive primary healthcare or the non-communicable diseases app. It is a real-time data entry and follow-up. And we have the Ayushman Bharat HWC portal, which has the monthly reporting. And also, we can use the telemedicine platforms for the specialist advice. And it is now recommended that every patient should be having a health ID for, or the ABHA ID for the which is needed for the patient tracking. So this is just a just a gist of what I was talking, that this is the NCD tracking app. So we can have this app logged in by our patients. And the important thing is the health promotion activities. How can we promote health, and how can we do these activities? So these activities can be by the IEC or the information, education, and communication. Like on tobacco cessation, we can have the education on the diet, we can have the education on the physical activity, and they can be conducted at the village level by the NCD camps. Okay, then we can collaborate with the schools, we can collaborate with the panchayats, and some of the group housing societies also, and the state governments also. Then we can have such day celebrations, like we can have the World Hypertension Day celebration, World Kidney Day celebration. Okay, we can have the Diabetes Day celebration. So these, we can have the NCD related day celebration. On those days, we can have particular camps, we can have particular diet education, we can have particular activity education, and we can conduct some RBS checkup camps and all. So these health promotion activities can be followed in the futures, in the ground level or the village level things. And if we talk about the monitoring and evaluation, so in the monitoring and evaluation, we have to maintain the individual health records. Then we can report the key indicators monthly. Suppose if I have made a random sugar as a key indicator, so I can keep this report indicator monthly. So how much in my area the sugar level is increasing, or the number of deranged sugar patients is increasing. And then we can conduct a quarterly review meeting with our seniors, so that we can have the resources accordingly, or we can have the requirements accordingly. And also use this NCD dashboard to track the progress of our patients. And when we are doing anything, we have challenges. But like I say in my office, if you have a challenge but no solution, then you are my problem. So when we are talking about challenges and solutions, so like everywhere we feel that the human resource gap is a challenge. So when we have the solution, we can shift the task to the CHOs. Then the follow-up is poor of the patient. So how to do the follow-up? We can have the digital tracking of the CHO visits. Then the awareness, we can have these campaigns which we were talking about in the last slides. Then the supply issue, and then we can ensure the regular logistic review by our seniors or by the healthcare department, so that there is a regular logistic review of all these things, so that we don't follow up all these challenges. So now if we talk about the behavioral changes, first is imparting the awareness. Okay, so first we impart the awareness, then we create a knowledge about a particular thing, then we have the contemplation, then we have the intention of changing, then there is an action for that change, and then you have to maintain that change. Okay, so these are the 6 stages of the behavioral change model. So when we talk about the behavioral change model, we have first the pre-contemplation. भाई there is no mention to change the behavior. आज तक मुझे किसी ने बताया नहीं कि भाई obesity इतना बड़ा challenge है. So first is the awareness model, and then we have the contemplation. So we create an awareness. So greater awareness of the behavior is to be done. So we are not committed to change, but at least we know. Then there is a preparation, intent on taking actions. अरे भाई अब मुझे ये पर्टिकुलर काम करना है क्योंकि मेरी अब नॉलेज बढ़ गई है कि साहब मुझे डायबिटीज हो सकती है. अब मुझे इसमें दिमाग में बैठ गया है कि साहब डायबिटीज हो सकती है. अब मेरा प्रिपरेशन लेवल चालू होगा. फिर मैं मेंटली प्रिपेयर होऊंगा, बाकी चीजें प्रिपेयर करूंगा कि मुझे वॉक करने कहाँ जाना है, एक्सरसाइज करने कहाँ जाना है. देन कम्स द एक्शन, द एग्जीक्यूशन ऑफ द प्लान. लाइक अब मैं आज से वॉक करने जा रहा हूँ, आज से मैं एक्सरसाइज कर रहा हूँ, मैं फना जगह जाऊंगा और फना खाना खाऊंगा. तो दिस इज माई एक्शन. देन देर इज अ मेंटेनेंस. सो आई वर्क टुवर्ड्स सस्टेनिंग माई बिहेवियर. मैं 2 दिन एक्सरसाइज करके तो ठीक नहीं हो जाऊंगा, ऑब्वियसली नहीं. तो आई हैव टू मेंटेन दिस एक्सरसाइज फॉर अ प्रिटी लॉन्ग टाइम. सो आई वर्क फॉर मेंटेनिंग दिस behavioral change or the relapse. So this is maintenance. And then there is the termination. So termination कब हुआ? जब चाहे सर्दी गर्मी बरसात कुछ भी हो, साहब मैं एक्सरसाइज करने जरूर जा रहा हूँ. सो देर इज अ जीरो टेम्पटेशन टू return to the previous behavior. So this is known as the termination. So we have to create awareness first, knowledge, and then this is the contemplation part, which we have to ensure in all our patients or all the population. And these are the last some slides, so which I would like to say that these are the means what exactly is a NCD clinic and how should we focus on creating a NCD clinic. So NCD clinic is a specialized health center which is focused only on the prevention, diagnosis, and management of the NCD or the non-communicable diseases. So what does a NCD mean? It is a multidisciplinary team, not only one doctor or nurse or no, it is a multidisciplinary team which should comprise of doctors, nurses, dietitians, the mental health professionals, and the focus or the aim should be to provide a long-term care for the chronic diseases. And these should be the focus of the team, that it should be able to screen and the early detection of blood pressure, diabetes controls. Then there should be chronic disease management of diabetes, hypertension, asthma, the cardiovascular care. The proper counseling of the lifestyle should be done, the nutrition, the exercise plan, the stress management, and we should be having a mental health support for psychological counselings for all the NCD patients. Then the medication and the monitoring, the prescription should be audited, the prescription for the long-term NCD care should be monitored and audited. Then if we are having a government run clinic, so it should be providing care for the continuous diseases or the chronic diseases like the diabetes and hypertension. And if we talk about the camps, we can have the temporary health camps, which can be organized in the communities, which offer free or low cost screenings. Like we can have the blood pressure, sugar, cholesterol, or BMI screenings. Then we have the public awareness modules, which educate on the lifestyles, the NCD risk factors and preventions. Then we can have the referral, and like if we are able to detect a high risk early NCD for a further treatment, or we are able to detect a cancer which has to be moved to a higher center, then these should be referred. Then we should be also having the community engagements, like we were talking, we can engage with the schools, we can engage in the workplaces, we can engage with the panchayats, or we can engage with the state governments to reach the undeserved population. So this is just a overview of what I was talking, that we can engage with some companies for health camps, or we can engage with the health centers or the Jila Panchayats. So in all, the NP-NCD camps, they are very important for our rural population to screen for all these things. And I end my talk with the last slide for the key takeaways, saying that the NCDs, we all know they are the silent epidemics, and the early detection is the only crucial treatment which we can offer for our patients. And the medical officers, they are the center, they are centered to the integrated NCD. So if we want to achieve this UHC or universal healthcare, the MOs are pivotal, or they are the fulcrum on which everything will rotate. And we should use the NP-NCD protocols, the technology should be used, and we can have a team-based care to prevent and promote our care. And prevention and promotion is very important. Rather, I should say that it is more important than the treatment. And if you want to, because this was a short talk, so if you want a further detail, you can have it by these resources. This is the NP-NCD guidelines, the ABHWC portal, then the WHO PEN guidelines, and the CPHC NCD app user manual. So I thank you all for a patient hearing, and over to Dr. Ramesh and Dr. Avinash. And if we have any questions, so I'll be happy to take.
Yeah, so we are very grateful to you, Dr. Ajay, for having that wonderful talk on this topic, because you have very categorically highlighted the five mantra, the achar, व्यवहार, आहार, और यही से यही एक हमारी रूट है. और प्रिवेंशन जितना कर लेंगे, the more we do, the more we screen, the more we are able to adapt a healthy lifestyle, the more we are able to run the awareness campaigns. So probably that will achieve the goal for which we all are running. So we can have one or two questions if they are in the chat box. So questions particularly, I don't think so. There are many questions. District Bhatinda. So people have just acknowledged and thanked you for your wonderful talk, sir. Probably we are also running short of time. So what we can do is that they can post their questions on the email ID which ECO, Mr. Avdeshji will support, and the PPT can also be provided on the ECO platform. And with this, I will like to close this webinar, and must congratulate you and thank you for giving this wonderful deliberation on the World Health Day. And at the same time, I am very grateful to the participants who have taken their time to sensitize themselves and be a part of our common endeavor to achieve the goal of World Health for all. Thank you,
Thank
Doctor.
you, sir.
Thank you,
And
Doctor.
I'm also grateful to all the listeners who were patiently listening. And thank you to you and Dr. Avinash, Dr. Avdesh, and Dr.
Avinash.
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 Nee, Avdesh also is there, no, sir?
Yeah, Avdesh also. He is from Eco team.
For a seamless transmission of this.
Definitely. And every time he does it like this.
Thank you, sir.
So we can wind up this, Avdeshji. Eco team, we can close the session. So you can log out, Dr. Ajay. We can also log out.
Thank you, sir. Thank you.
Thank you once again. Thank you.